Hello, everyone. Welcome to We Love Nogales with Mariposa Community Health Center here in Nogales, Arizona. My name is Eladio Pereira. I am the Chief Medical Officer at Mariposa. And today we're going to discuss influenza. It's already September 4th, and we begin our influenza season and our vaccination campaign to reduce the risk of influenza and its complications. As we know, influenza can be a very severe illness, different than the typical cold caused by certain rhinoviruses. Typically, the cold will be manifested by mild cough, nasal congestion, sore throat, and usually no fever or a very low fever. Influenza have a fairly distinct syndrome characterized by high fever, a sore throat, cough, and runny nose, and fairly significant muscle pain, a lot of myalgias, and it sometimes leads to a very significant prostration. So it's a very distinct syndrome. We're able to test for influenza, sometimes very difficult to distinguish from COVID-19 and the RSV, but at our clinic we're able to test for all three. So we do recommend that those individuals who have those symptoms be tested to determine whether they qualify for treatment or not. We want to make the diagnosis of influenza fairly quickly, typically within 48 hours, to determine the efficacy of treatment. We know that the best way to prevent influenza is through vaccination. At the moment, at Mariposa, we're vaccinating with influenza those patients who are high risk, typically those patients with 65 years of age and older, those with chronic conditions, and also patients who come for regular appointments. Very soon, we're going to release an announcement about vaccinating the entire community. So be aware of that. It's really important to get vaccinated to reduce the risk, not just of influenza, meaning the syndrome, but also the potential complications of influenza, which can happen a week, 2 or 3 weeks later, which may include a secondary bacterial infection in the lung. We call that secondary bacterial pneumonia, and in some cases cardiovascular events, which happen several weeks later. So please be alert to that, get vaccinated against influenza. And then I'm going to switch to Spanish for our Spanish patients. Mi nombre es Eladio Pereira, el director médico de Mariposa. Ya viene la temporada de la influenza. La influenza es un virus que causa un síndrome caracterizado por fiebre alta, dolor de garganta, tos y dolor muscular muy intenso. Es distinto al resfriado o al catarro, que en general no causa síntomas tan serios. Causa dolor de garganta, congestión nasal y usualmente no hay fiebre. Es muy importante hacer el diagnóstico de influenza para reducir las complicaciones que pueden suceder 1, 2, 3, 4 semanas después, que incluyen neumonía y problemas cardiovasculares. La mejor manera de reducir el riesgo de la influenza es a través de las vacunas. En este momento en Mariposa estamos vacunando a los pacientes que tienen 65 años de edad o más y pacientes que vienen para citas de rutina. Pronto vamos a hacer un anuncio acerca de la vacunación para el resto de la comunidad. En Mariposa tenemos las pruebas para hacer el diagnóstico de influenza, que también incluye las pruebas de COVID-19 y otro virus que se llama RSV, que también causa problemas respiratorios. En esas dos enfermedades, influenza y COVID, es muy importante hacer el diagnóstico a tiempo. Mientras más rápido se haga el diagnóstico, más eficaz va a ser el tratamiento para COVID con Paxlovid y a través de otros tratamientos para la influenza, también con una medicina que se llama oseltamivir o Tamiflu. Es muy importante estar pendiente a los anuncios, venir a vacunarse a Mariposa para reducir el riesgo de la enfermedad que en algunos casos puede ser muy seria. Con eso terminamos la transmisión del día de hoy. Gracias por escucharme. Nos vemos la próxima vez. See you the next time. Thank you very much.